during movement. So this is what we call the vertebrae. You can see they are a series of bones, and they are connected to the intervertebral disc, which is some type of rubber bands that hold this together. Hold this together. In that way, it makes them flexible and they can move. And it acts like some type of shock absorbers, like in the cars for the tires. So in that way, they don't get damaged when they move, or it protects also the vertebrae. So now, when this elastic cord is squeezed out of this proper place, it presses on the nerves. This is called a slip disc. What is this? If you see in the picture, you can see the vertebrae. This is the yellow bone, and then you can see the little rubber bands, which is cartilage tissue. And you can see that this came out of place. So it's a little inflammation there and a little damage. So this is what they call a slip disc, and it's not bad. It's when things, when the spine gets disaligned, then it can be really bad. And I'm going to show you another video about this, so you have a sense of what is this.
The human spine is made up of 24 spinal bones called vertebrae. The vertebrae are stacked on top of one another to create the spinal column. The spinal column gives the body its main upright support. From the side, the spine forms three curves. The neck, called the cervical spine, curves slightly inward. The mid-back, or thoracic spine, curves outward. The outward curve of the thoracic spine is called kyphosis. The low back, also called the lumbar spine, curves slightly inward. An inward curve of the spine is called lordosis. The lumbar spine is made up of the lower 5 vertebrae. Doctors often refer to these vertebrae as L1 to L5. The lowest vertebra of the lumbar spine, L5, connects to the top of the sacrum, a triangular bone at the base of the spine that fits between the two pelvic bones. There is a joint on each side of the sacrum that connects the sacrum to the pelvis. This joint is called the sacroiliac, or SI joint. Each vertebra is formed by a round block of bone called a vertebral body. The lumbar vertebral bodies are taller and bulkier compared to the rest of the spine. This is partly because the lumbar spine has to withstand pressure from the body weight and from daily actions like lifting, carrying, and twisting. A bony ring attaches to the back of each vertebral body. When the vertebrae are stacked on top of one another, these rings form a hollow tube called the spinal canal. This bony tube surrounds the spinal cord as it passes through the spine. Just as the skull protects the brain, the bones of the spinal column protect the spinal cord. The spinal cord extends from the brain to the L2 vertebra. Below this level, the spinal cord splits into a bundle of nerves that goes to the lower limbs and pelvic organs. The Latin term for this bundle of nerves is cauda equina, meaning horse's tail. As the spinal cord travels from the brain down through the spine, it sends out nerves on the side of each vertebra called nerve roots. These nerve roots join together to form the nerves that travel throughout the body and form the body's electrical system. The nerve roots that come out of the lumbar spine form the nerves that go to the lower limbs and pelvis. The thoracic spine nerves go to the abdomen and chest. The nerves coming out of the cervical spine go to the neck, shoulders, arms, and hands. It is sometimes easier to understand what happens in the spine by looking at a single spinal segment. The spinal segment includes 2 vertebrae, the intervertebral disc between, the 2 nerve roots that leave the spinal cord at that level, and the small facet joints that link each level of the spinal column. An intervertebral disc is made up of 2 parts. The center, called the nucleus pulposus, is spongy and acts like a shock absorber to cushion the force between each vertebra. The nucleus is surrounded by a series of strong ligamentous rings called the annulus fibrosus. Ligaments are made of strong connective tissue and connect one bone to another. The annulus fibrosus is actually a special ligament that connects 2 vertebrae together. Between the vertebrae of each spinal segment are two facet joints. The facet joints are located on the back of the spinal column. There are two facet joints between each pair of vertebrae, one on each side of the spine. A facet joint is a small bony knob that sticks out from the vertebral body at the back of the lumbar spine. Where these knobs meet, they form a synovial joint that connects the two vertebrae. The facet joints of the lumbar spine move together in a sliding motion as you bend forward and backward. The surfaces of the facet joints are covered by articular cartilage. Articular cartilage is a smooth, rubbery material that covers the ends of most joints. It allows the bone ends to move against each other smoothly without friction. Two spinal nerve roots exit the sides of each spinal segment, one on the left and one on the right. As the nerves leave the spinal cord, they pass through a small bony tunnel on each side of the vertebra called a neural foramen. The lumbar spine is supported by a complex set of ligaments and muscles. The ligaments are arranged in layers and run in multiple directions where they connect the bones of the lumbar spine to the sacrum and pelvis. The muscles of the low back are also arranged in layers. Those closest to the surface are covered by a thick tissue called fascia. The middle layer runs up and down over the lower ribs, chest, and low back. They blend in the lumbar spine to form a thick tendon that binds the bones of the low back, pelvis, and sacrum. The deepest layer of muscles runs along the back surface of the spine. These muscles connect the lumbar vertebra, pelvis, and sacrum and coordinate movement with the muscles of the abdomen to help hold the spine steady during activity.
Okay, as we saw in the video, the spine has two mutually exclusive functions that it needs to balance. It houses and protects the nervous system and allows for mobility. When there is a conflict, protecting the nervous system in the body is the body's top priority, and the muscles connected to the spine go into spasm to prevent mobility. The skull and the spine house the central nervous system and have holes that allow the nerves to communicate between the central and the peripheral nervous system. As you can see here, if you see in the middle of the bones, you can see all those little things coming. Those are is the central nervous system, which go all the way from the spine to the brain, back and forth. Now, have questions here? Up to this point, anybody has questions? Okay. Okay, next section, we're going to see the negative influences and risk factors. These are a few examples of how important roles every vertebrate plays, so we can have a good health and we can have certain functions in our body, and also it interacts with the other systems in the body. This is the role of the lumbar spine. This is only a few examples. I know there's many, 32 to 34 bones, but I'm just giving you some examples. For example, L1 regulates the function of large intestines and the inguinal rings. L2 sends communication to the appendix, the abdomen, and the upper legs. L3 sends communication to the sex organs, uterus, bladder, and the knees. L4 regulates the function of prostate gland, lower back muscles, and sciatic nerve. L5 communicates with lower legs, ankles, and feet. And the sacrum sends communication to the hip bones and the buttocks. And finally, the coccyx regulates the function of the rectum and the anus. Actually, your lumbar spine and pelvis, they do a lot to support your body. In fact, each vertebrae and bone correspond to one different part of each body. Every part of the body is interconnected either by the bones or by the central nervous system. Now, common issues with the misaligned lumbar spine and pelvis include sciatica, lower back pain, leg pain, and pain while sitting. Now, what happens when we have weakness in the spine? Common problem areas in the spine that yogi practice can help are upper back and lower back pain, also neck and lower back pain. We can see here in this picture the types of damage that we can do to a disc, and this is because this is an imbalanced spine. You can see the first disc is blue; it's just a normal healthy disc. The second one is a bulging disc. You can see there is a little bit of inflammation. Is red. It's a little bit of damage, but not as bad as the next. The next one is a herniated disc. You can see the damage came out of the disc already. And the next one is already degenerating. Is causing damage and is pretty much eating the cartilage. And the last one is one disc already damaged. You can see the tiny what size it became compared with the other one. You can see the last two, the size is like less than half the size of a healthy one. So this is because we have an imbalanced spine, and this can generate several problems, actually a lot of problems. Now, back pain is not caused by a pinched nerve. It is often caused by muscle imbalance and less than optimal spinal mechanics. People tend to be too strong or too tight in their front thighs, chest, and posterior neck muscles. People tend to be weak in the hamstrings, buttocks, abdominal, middle back, and anterior neck muscles. So every time that we have a muscle and spinal imbalance, we have back pain. Now, what happens when we have weakness in the neck, which is the first, the cervical spine, the first part of the spine? Well, muscle imbalance in the neck, especially weak anterior neck muscles, tends to produce a posture that reinforces the imbalance. The neck tends to strain it and shift the head forward, which puts a strain on the muscles in the upper and back, on the upper back and back of the neck. And one problem very common with in the neck is tech neck. So what is exactly tech neck? Tech neck is a type of pain that is caused by repetitive strain and injury to the muscles and other tissue structures of the cervical spine. And this is mostly caused by the use of technology like cell phones and computers. If you see this graphic, you can see the person, a totally healthy person with a straight spine, compared with a person that is always on the phone and his spine is down, like it's getting curved already. Now, another problem that we can have with the spine is weakness in the lower back. When the lower back is weak, it tends to arc forward and put pressure and strain on the joints on that region. Good yoga exercises for this weakness are those that involve stretching the overlay tight muscles and exercising the weak muscles. Control elongation is the most important motion, especially in the abdominal area. This elongation is provided by controlling the lower face, legs, lifts or sit-ups, and that means keeping the lower back pressed as flat as possible during any leg lifts and especially during stretch sports. So there's many examples in the book that you can use in the training book, the teacher's training book, that you can use to align the spine. There's many kriyas that are specifically made for the spine. Okay, and any questions up to this point? Okay, now the next, how can yoga help with this? How can we fix these problems with the spine, all these problems? Okay, first, rehydrates. Yoga rehydrates the disc to normalize the structure and function. You can see this graphic. There is a totally healthy, normal spine. And you can see the body of the vertebrae is the brown part and the intervertebral disc. This is a type of rubber band that is holding together and makes them be mobile. And you can compare it with the one below. It's a spine rehydrated, the bones are spurring, and the disc is so narrow that it's almost nothing. So this happens when we don't have a healthy spine. when we don't have enough, we don't drink enough water, or there's some type of dehydration there. So by doing yoga, we can rehydrate at this to normalize, to put it back as a healthy spine. Another thing that yoga does, it expands the ribs. Long deep breathing expands the ribs and the spine. The cranial bones move with the rhythm of the breath, and spinal and cranial movement pumps the cerebrospinal fluid. This is in the process of inhale and exhale. As we expand the lungs, then we are pumping all these fluids through the spine and through the other systems in the body. Another thing that yoga does, it circulates the spinal fluids. The movement of the sacrum circulates the spinal fluid. This is when we do certain movements like what? Like when we engage the bandhas, then we are working with the sacrum. Then we can, by doing those movements, we are circulating the spinal fluid all over the body. And muscle strengthening. This is mostly for when we do stretches. Stretching resets the resting tension in the muscles alongside the spine and strengthens and repairs in specific muscles. If you see how many groups of muscles we have along the spine, there's many hundreds. So by doing yoga, also we are, especially when we work on the core, planks and anything that strengthens the core, then we are working on the spine and the muscles around the spine. So this is just few of the many things that yoga can do for us when we practice it and we want to keep a aligned and healthy spine. Any more questions up to this section? Okay, there is many yoga exercises that I suggested in the book, in your teacher's manual, and these are some of them. Kriya for the lower spine and elimination, and you can find this Kriya in the Sana guidelines on page 52. And also flexibility in the spine, also in the same Sana guidelines. The basic spinal energy series is really good for to keep your spine healthy. And any exercises that strengthen the abdominal muscles. And of course, spinal flex, cat-cow, and cobra. That's why we normally start warm-ups with spinal flex, cat-cow, because we don't want to strain the spine, especially we are doing a hard kriya, or we're exercising in excess. We want to do warm-ups in the spine, okay? And I'm assuming no more questions. Okay, now there is some cautions that you need to take as a teacher when we are teaching yoga, especially with the spine, because it's a very important part of our body, but also is very delicate, and this is something we normally have to take care when we teach yoga. So, and general cautions. There's some advice that comes in the book, in your teacher's manual. It says, encourage students not to be competitive or push the spine and neck aggressively. More progress is made when moving slowly and consistently. When there is pain, numbness, weakness, or lack of muscle control in the arms or legs, or especially if there is sudden onset of difficulty controlling urination or defecation, this is an indicator of a significant neurological problem. The student should see a physician promptly before continuing yoga. Okay, this is one of those general things that we all teachers have to watch out when we have students, especially new students. Now the warm-ups, what I just mentioned before. This is a good idea to use a warm-up set in which increases flexibility before doing a challenging kriya, okay? And the most normal warm-ups that we do is cat-cow and spinal flexes. the lower back. Be sure to keep the abdominal muscles engaged and the lower back flattened against the floor when doing leg lifts. And also, if the back arches up to the, it means the psoas muscles that which are already too strong are working and not the abdominal muscle. Okay, this is really important. For the lower back, it is important that we are exercising the abdomen. Why? Because the abdomen is a very strong muscle, and we want to take a little strain and pressure from the spine by using the abdomen. So this is important that we don't damage our lower back by not using the abdomen and using the spine. Okay. The neck. Keep the neck lap applied in poses that involve lifting the head. This stabilizes the shoulder blades so we can use our arms. We can do this with either the upper trapezius muscles or the muscles in the mid-back. However, if we use the upper trapezius muscles, we are hanging our arms in our necks, putting a strain on the neck. Therefore, mechanically speaking, using the muscles of the mid-back is preferred. Okay, what does it mean? It means that since the neck is just this little tiny muscle that is holding the body and the head together, it's important not to put a lot of strain or pressure. So we try to put all the pressure in a different place. In this case, can be the mid-back, or it can be shoulders, any other muscle, but try to take care of the neck because it's really important. We don't want to break our necks doing yoga. Now, the cobra pose. This is a problem for many people. Stretch the chest forward as opposed to shortening our back so that the joints of the lumbar sacral spine are not riding on each other. Just modify cobra when necessary. For example, you can rest on your elbows or rather than your hands. Like you have this problem like me that in my hand joints, normally is what I do. I rested in my elbows and also the toes. You can also alleviate some pressure from the toes if you are doing cobra. Headstand. In Kundalini yoga, we don't do headstands and we never put pressure on the cervical vertebrae. Shoulder stands. When you do a shoulder stand or you have your students do a shoulder stand, make sure the weight is balanced in the shoulders and again, not on the neck. So just that's why they are called shoulder stands, because all the weight should be held by the shoulders. Flow pose. Don't push it. It is better to increase the mid-back stretch before going into it fully. What does it mean? When we do flow pose, we do it gradually, like maybe lifting the legs 90 degrees instead of going all the way to the back, and then increase little by little. Why? Because this is taking care of our spine by doing this and our neck. Stretches. Generally speaking, avoid bouncing stretches since they send a signal to the muscle to tighten it up. Encourage gradual, consistent stretching, synchronizing with the breath. Okay. What does it mean that you have to that it's better to synchronize the stretches with the breath? When you synchronize your asanas with your prana, you are using less force and you are putting less pressure in your body, in any muscle, in your spine, especially. So because prana itself has all this force that is making you doing the exercises. So yeah, it's important to support all this in the prana and not in your spine or your neck. Rest. Regular and sufficient rest is just as essential as regular physical activity to muscle function and development. And last one, pregnancy and menstruation. It is important to inform women, especially you have new students in your class, it's important to inform women of the limitations necessary when doing yoga while pregnant or menstruating. Remember that the limitations for doing yoga while pregnant are written for yogis. Start by assuming the pregnant woman has never done any yoga or exercise before. So yeah, we always have to be cautious with somebody pregnant. You wouldn't want the person to overdo an exercise, and it can be bad. Now, why does Kundalini Yoga omit headstands? Someone knows this?
You don't want to put pressure on the spine?
Yes.
Cervical spine?
Yes, exactly. Shoulder stand, plow pose, or other core straining inversions have a lot of benefits. Practicing handstands has similar benefits, but with the additional risk of extreme pressure on the cervical spine, okay? The risk of putting the entire body weight on the tiny vertebrae of the neck is not worth the potential benefit of a handstand. So this was written by Yogi Bhajan in 2010 and Sullivan in 2014. Okay, what does this mean in translating this to English? This means that headstands are good, but there's a lot of other exercises that you can do and get the same benefits and without risking breaking your neck. So it's not really worth to break your neck because those are benefits that you can get anyway doing shoulder stands or doing any other exercises, okay? So that's why Kundalini Yoga doesn't have headstands. Now, I'm going to give you 10 fun facts about the spine, things that I'm sure most of you didn't know. For example, October 16 is World Spine Day, and I bet nobody knew this. I didn't know, I just found out. So it's gonna be in a few weeks in case you guys want to celebrate the World Spine Day, that it is. Also, if your spine didn't have curves, it will be nearly as strong as it is. So this is the important role that all the bones and the cartilage plays in holding, not only holding the spine together, but keeping it strong. About 10% of the population has a 6 lumbar vertebrae. Humans have the same number or vertebrae in the neck as a giraffe. How many they have? I just told you. How many vertebrae we have in the neck? 7. So giraffe has also 7. I didn't look for a picture or anything, so I cannot imagine the size of the vertebrae or a giraffe, but they have the same number as humans. Astronauts can return to Earth up to 3% taller due to the expansion of cartilage in the spine in response to lack of gravity in space. If it wasn't for your spine, you wouldn't be able to bend, dance, or drive a car. And guess what? You won't be able to do yoga. Humans are born with 33 spinal bones, but end up with 26 as adults. That means that we all have 26, except the babies. All the babies have 33, and during the life, for some reason, they start losing them. The spine has an incredible, important job to protect your body's nervous system. As we age, the space between the spinal discs gets smaller. This is why some people lose an inch or more height over time. And finally, this is funny. The tailbone, also known as the coccyx, gets its name from a resembling to the beak of a cuckoo bird. And this is all my presentation. Do you have any questions? Or